Hello and welcome to the Athena 40 podcast, Bouncing Back. I'm Elizabeth Filippouli, founder of Athena 40, an international platform promoting female leadership and connecting individuals from all over the world to exchange knowledge and insights. In this podcast, we are interviewing thought leaders, entrepreneurs, influencers, and decision makers from all over the world. We're bringing you insights related to developments triggered by the coronavirus crisis, and we speak with change makers from across different industries. My guest today is Helen Disney, the founder of Unblocked, a hub for blockchain events, education, and information. Unblocked acts as a bridge between the technical and business worlds, helping executives to understand the opportunity blockchain technology offers to their business. Prior to moving into fintech, Helen founded the Stockholm Network, an events and research network of over 120 member organizations across Europe to connect thought leaders and policy experts and create best practice in public policy making. Helen, I'm delighted to welcome you to Bouncing Back.
Thanks so much for having me. It's a fantastic idea, and I'm enjoying already the concept of listening to these future podcasts as well as taking part in this one.
Thank you. Yes, these are very important conversations to have as we're navigating very complex situations and a new reality, which is an unthinkable one for all of us. Now, for those of us who are less familiar with cutting-edge technology, how would you describe blockchain?
So blockchain can be many things to many people, but it came about as a result of the creation of Bitcoin, which is a cryptocurrency or a form of digital money. And the reason that the blockchain was useful in that context was to keep track of all the transactions on the network and to give people kind of like an online bank statement of their transactions so they could see and prove where the money had gone to. So if I send money to you or you send money to me, we can see in a shared public ledger, like a sort of audit trail, all the things that have happened on that network, because there's nobody in the middle to confirm. So there's no bank or credit card company in the middle to confirm that the transactions have taken place online. So it basically allows us to trust one another in an online world and to be able to share value, whether that's money or whether it could also be data or information. So when we think about blockchain for use outside of cryptocurrency, it can be used in many other ways in enterprise that doesn't involve cryptocurrency. So the technology came from there, but it's now being applied in other ways, in other contexts. So we can start to see its use in healthcare, which we're going to talk about, obviously, in the current public health crisis, tracking data, verifying data, supply chains, identity, different areas where being able to have a shared source of truth. Someone described it as a receipt we can all agree on, which I thought was an interesting way of describing it, allows us then to sort of prevent the kind of information asymmetries that we might see in the current coronavirus pandemic, where we want to gather information, but it's coming from a lot of different places and we can't necessarily check what's true or have a sort of single bird's eye view of the truth.
Mm-hmm. So epidemiologists who study how diseases spread, they are being faced with the task of gathering, verifying, and cleaning data in an efficient manner. However, privacy and security issues, language barriers, or the sheer distance between the geographical location of an outbreak, as well as cultural differences, or even how states are run. There are a number of different factors and issues that slow the transmission and also the exchange of necessary information. How can blockchain technology help?
So that's a very interesting area where already, even before this current crisis, medical professionals and researchers were looking at using blockchain to try to break down some of these barriers in medical information sharing, because you tend to have, as you said, silos of data, either because information is stored in different databases in different ways. So even for something like cancer research, you'd think, well, there's a huge social impetus for medical researchers and pharmaceutical and others to share cancer data outcomes, but actually it's just practically very difficult to do that because of the way our technology systems are set up, and they're in all these different pockets and different places. What blockchain can allow us to do, if people are willing to collaborate over a blockchain network, is to kind of share data across organizations or across these kind of social barriers that we've set up in the past for various reasons. So we can start to kind of have a shared database which could benefit all the different members, even though they may have different commercial sensitivities or different cultural barriers. And so when we look at the coronavirus outbreak, for example, there's companies now that are doing just a tracker to show where outbreak is taking place. Just look at the numbers and try and verify the data so that we don't get fake news. We don't have countries that might want to cover up how many cases are being reported. So in certain countries, perhaps citizens could be reporting data, and that could be verified in certain ways using technology rather than it coming from the government, if we think it's a government that might not be trusted to give out valid data about the situation. So that's a really interesting example where we can see that blockchain could allow us to have a more trusted, maybe not, it's very difficult to ever say what 100% trusted, because it does depend what information you're putting into any database, whether it's a blockchain network or any other kind of traditional database. But we could start to have a clearer picture of what's going on in the world. And blockchains can update in real time. So it's very quick to be able to find out information and to sort of see it in a visualization and see what's going on.
And I guess that triggers my next question. What happens when some governments, they're not open in sharing data? In fact, they refuse to disclose real data and what is really happening on the ground within their borders. And as we know, China, for example, has been accused of not alerting, if you like, the world in time for pneumonia or cases related to a form of pneumonia, which were first detected back in October, November 2019. So what happens, and how can blockchain technology bypass the reality on the ground when a country's government just doesn't disclose to the world what is really going on?
Yeah, I think it's very tricky in some senses because, at that time we probably wouldn't have known what this was. So the world wouldn't have been able to respond in that way, because until you sort of identify what the problem is, we wouldn't have had the means to know what the problem was and start to circumvent that situation. But for example, if scientists were doing research and discovering something and perhaps the government wasn't prepared to take it seriously, that could be uploaded to a decentralized network. Blockchains are essentially decentralized networks. They're not run by any government. They're often open, public, open source projects. So you could potentially, take what's called a hash of that data, put it on a blockchain. So you could essentially timestamp the discovery of a particular new virus and put it on a blockchain to say, okay, well, this has been identified by a scientist. Let's see if any other scientists around the world have identified the same thing. So that would be one way potentially in future you could do that. And I'm not trying to say that blockchain will sort of save the world or that all these things are ready now, but we're likely to get more future pandemics. We've already had SARS, we've had MERS, now we've got the novel coronavirus, COVID-19. There's going to be other pandemics in future. So if we think about what might happen in a future outbreak, obviously we're still dealing with this one, and it's hard to now start thinking that we might be in this situation again, but most likely that's going to be the case. So if we could start to think the implications through now, we could maybe deal with it better in a future scenario.
Which is a very frightening prospect, and we need to make sure that we prepare for whatever the future may hold for us, and get in place technologies which can help towards preventing or containing viruses. I mean, containing the coronavirus, or as a matter of fact, any viral disease, could come down to a question of data management. So scientists, for example, will need high quality data to model viruses. And then with models, they can provide governments with recommendations about how to contain the disease. But that data is hard to get, or its integrity cannot be verified, and thus of no use to epidemiologists. How can blockchain or tools which come out of blockchain technology can assist?
So I think there's a few different ways, both to gather the data using a combination of technologies, not just blockchain, but a combination of digital health technologies. And then there's also ways to use that technology to help contain the outbreak itself. So if we look at something like remote care, I work closely with a company called Punya Care at the moment, who were an existing company before this outbreak happened. The entrepreneur who started the company had the idea of wanting to care for her mother in India remotely and keep track of her healthcare. She developed a remote monitoring device. I mean, this is just one example of a company. There's lots of others that do similar things. So the device is a little kind of box that you can use to measure vital signs. So things that are very important in coronavirus, like knowing someone's temperature changes. That person can have that device, they can actually use it at home, or if needed, it could be interpreted by a doctor so that they could take their own measurements, and then it could be uploaded to a dashboard in the doctor's surgery or the nurse's station. And then we can start to see, if someone's temperature spikes up, for example, then maybe they are already in need to be self-isolated, and the doctors and nurses don't have to directly interact with that person either, so they're not going to be at risk of infection. So it's containing the disease by keeping the potential patient at home, it's keeping the doctors and nurses safe, but then also you will start to see patterns in that data. So that the health dashboard could be connected to a blockchain platform, and that data could then be shared with other people all around the world. So it's not limited by geography. It doesn't matter if you're in the UK NHS or you're in Africa, anybody around the world could, in theory, use a device like that, upload the data to a dashboard, which could then be managed as part of a platform. And you can combine those platforms with other technologies. So artificial intelligence can be used to actually kind of identify patterns in that data, because obviously a blockchain is really only a foundational technology in the sense, if you think of it as a fancy database, the information is gathered there, but we still need to interpret that data, and a blockchain itself can't do that. It's really just a data structure. But what it could do is link with other technologies to then say, well, look, let's look at different countries around the world. Let's see if there's any hotspots or patterns emerging where more people are developing clusters. So Wuhan, obviously, in this current situation would have been one. Lombardy in Italy would have been another. So we'd start to see patterns emerging where healthcare information was coming in, showing that there were clusters of people starting to suffer from this disease.
And you are raising a very important issue, Helen, which is the lack of innovation in healthcare systems. One of the major reasons why countries and governments have panicked over these past weeks is because they are concerned that their public health systems are under-equipped and they cannot handle a high number of patients with respiratory issues, which would result into a high number of deaths. So whenever we exit this crisis, hopefully in the not too distant future, what should be the priority of the public sector when it comes to updating and modernizing our healthcare systems to be better prepared for a future situation like that?
Well, this has been my passion for a long time, over 20 years. I worked in think tanks for about 15 years, and one of the big things I did was look at kind of consumer empowerment and modernization of health systems. And actually one of the reasons that I ended up in blockchain and bringing that back round was that I thought that blockchain offered such fantastic opportunities to do some of the modernization tasks that we need in healthcare that weren't really being done in a top-down way by government, because government tends to respond slowly to social pressure compared to technology. So there's a few big things, and in a way this crisis has some positive sides to it, which is that it's providing an impetus for innovation and creativity to solve these problems very fast, and a lot of smart minds around the world are really highly motivated now to turn their entrepreneurial spirit to creating solutions, whether it's sort of 3D printing ventilators, or whether it's people actually turning the computing power of a blockchain network towards medical research. So lots of different things are being done. But longer term, what should we do? We should try to create a unique healthcare identity for every citizen, because we already have, a government ID in the sense that governments issue us with passports and driving licenses and other things that identify us. But in terms of accessing services, it's very patchy. So we're kind of one type of person when we're in a school, we're another type of person when we're in the NHS, we're another type of person when we apply for, government benefits, and we don't really have a single unifying ID. So if we were able to each have a unique identity, they do this in Estonia, they have an e-identity system there, which allows citizens to have their own healthcare identity. And this has been going for quite a long time there. It almost sort of predates blockchain, and they now use a distributed ledger type system for that. That would be enormously helpful, because then we instantaneously know who people are. So we know how old they are. So we know automatically if they're vulnerable, for example, and they might need government assistance with food or medicine. So that has a huge amount of implications. I think that's one thing that we can do. I think ramping up remote care solutions, again, it reduces pressure on the healthcare system. So we're going to have limited resources, and maybe even after this immediate crisis is over, we're going to have fewer resources, because we're spending a lot of money to solve this crisis. So we need to find ways of doing things more efficiently. So, for example, if test results can be automated and put onto a blockchain-based healthcare record, then we don't have to waste time and money sending the results to the GP, then the GP mails them out to the patient. That could all be automated and done and just seen in an app on your phone. So there's many kind of efficiency savings we could have. Insurance claims would be another. If you think about the US health system, you get rid of a lot of paperwork and manual processes that happen. It's a very bureaucratic paper-based system that goes on behind the scenes in claiming for healthcare insurance claims. That could all be automatically done through what's called a smart contract, where you have a piece of software that automatically executes when certain conditions are met. So the patient uploads all the proof of their claim, and if it's all correct and it's been checked, then money can automatically be issued by the insurer. So there's many different examples. And I think the other facet of it is data privacy as well. So we are now giving up a lot of information online because of this crisis. But one of the interesting things about blockchain-based systems is you can create kind of a sort of a Chinese wall between the person and the data. So you can still share data, but you can make sure that the data is fully secure and anonymized, so that we know, first of all, what data we're sharing, but also we might only be willing to share certain data with certain people, and we can set those permissions up. So in a crisis, we might be willing to share our full data with the government so they can help us, but then maybe in another situation we would only want to share particular data with a specialist. So we can start to bring in a lot more efficient and streamlined ways of doing things if we start to bring some of these technologies into the healthcare system.
Helen, how expensive are such solutions? And I'm asking that question because currently absolutely every government around the world and every country is being challenged financially. So whenever we exit the crisis, some of the countries around the world will be perhaps on the brink of bankruptcy. So how expensive are such solutions to implement? And secondly, where do you see the role of the private sector? So how can the public and private sector join hands and private money support such platforms and solutions that will modernize the health systems, and they will also actively help our societies cope with the aftermath of the COVID-19 crisis?
It's a very good question. I mean, any new technology costs money to implement. And I think the biggest issue with implementing blockchain solutions in the public sector is not so much the technology itself. The technology is there. I think it's getting people to understand how it can be used. And it is not necessarily the same thing as cryptocurrency or Bitcoin, which is a sort of slightly alarming prospect for some governments. I think shifting towards how these systems can sort of be linked in and interoperate with existing systems is quite complicated. So it's not necessarily something that we can do overnight, but we could start to pilot smaller projects. I mean, smaller projects have already been piloted in the UK NHS. Things like medical credentialing is a good example, figuring out doctors and nurses who they are, and when they move around in the system, we don't have to keep rechecking their identity and their medical qualifications, because it's already sort of done in a single way, and then we just don't need to keep doing it again every time. And because that's decentralized, it doesn't have to be done in a top-down way. So one organization could implement medical credentialing, and then any other part of the system could access that. So that makes it quicker than, something like the NHS as a whole deciding, okay, right, we've got to implement one big top-down IT system for the whole of the NHS, which is a very complex set of essentially micro-organizations all under one brand. So I'm not saying it could be done overnight, but I think it can be done piece by piece. And I think the private sector can get involved in terms of collaboration. So a good example is face masks. So I was actually reading about this morning. So IBM already has a supply chain solution for blockchain for food, but companies like that are pivoting and looking at how could we create a similar kind of database of inventory of medical supplies. So, for example, some of the masks that could be used for medical professionals for protective equipment are also used in construction. So could there be a collaboration between construction companies and the medical world to say, all right, we have a certain number of these masks which we would normally be using on construction sites, but obviously our construction sites are closed. How can we just rapidly do a stock take and put all of that onto a blockchain so that everybody knows a single source of the truth, how many of these masks there are in the UK or in France or in Germany or another country. And we can then get those masks out to the doctors and nurses that need them as quickly as possible. So it's really interesting that, governments are slow sometimes because they're centralized, but we need centralized solutions now in certain ways. We need fast decision making from our leaders, and we need the money that comes behind that to actually pay for just these emergency services. But the private sector can have a role in turning its resources into a collaboration, which could then help the whole of society. And the quicker we get back on our feet, the quicker these companies will be able to reopen their construction projects and start the economy going again. So I do think that we will see greater public-private collaboration. And that was something actually we identified in a project I did about public sector use of blockchain, was the need for greater public-private collaboration, because some of these social problems won't be fixed by one party alone. It can't be just the private sector or the public sector. It has to be everybody working together for the common good.
Well, as you rightly said, there are some positive elements in this grim situation, because there are opportunities in every crisis. And we see many new trends emerging, and people will have to adapt to new realities. Where can you spot new opportunities, and how can we open new paths in order to bounce back?
So I think a huge amount of creativity is coming out of this crisis. And I think, already people are identifying new ways of working, and they're realizing that actually working from home is not necessarily as much of a risk as they thought. So I think for women, actually, particularly working mothers, this can be a good thing. Certainly myself, I've been juggling working from home and family and being an entrepreneur for a long time, over 15 years. And I actually quite enjoy the fact that now everybody sees the challenges of doing that, but also the benefits of doing that. So I think that is an opportunity for companies to reassess. We have a lot of companies that take huge expensive buildings in cities, and they have the lights on all night, and they use up a lot of resources to have that building. Do we really need to do all of that? If we're cutting back and we're realizing we don't have as much money, it can have positive impact for the environment. So people will look to save money by switching off the lights at night. They'll look to maybe downsize their buildings and allow more of their staff to work flexibly and work from home. And I think that can be very good for families and very good for women. So as an organisation like Athena 40 and Global Thinkers Forum that supports female entrepreneurship, I think that's a very good thing, that we're shifting to a different concept of how work and home blend together, and then they're not mutually exclusive things. And people can be very productive and very creative no matter where they work in the modern world. We have the internet, we have so many tools for remote working. I mean, you'd never have thought a few weeks ago that the cabinet would have a meeting via Zoom. And that might seem trivial in some ways, but actually, if you're a female member of the cabinet, and you're perhaps a younger woman with young children, being able to do a cabinet meeting over Zoom is a huge bonus for you. It means that you don't have to travel into town, you don't have to waste time commuting. So, there are positives. And for myself as an event entrepreneur, I was already thinking about what digital tools I could offer as a business to capture more of a global conversation for my work, because people are all over the world interested in blockchain, and I can't always bring them all to a physical event. And also physical events do have an environmental impact. So can we shift more towards digital events where we can find a lot of creative ways of doing the same things we would do in a physical room? And it's not the same as meeting people in person. We'll always still want human interaction, but we can capture a lot of valuable information and gather data about our audience by doing online events or podcasting like we're doing today, finding new ways to deliver content.
True, and I think that in a very odd way, we have been forced to become more inventive, more resourceful, and find ways to create conversations which we can communicate online. Whereas before, if you like, we were more of consumers of digital content. Now we have become more producers of digital content, and we are reinforcing our connections and our communications. I think it's a very interesting paradox, but of course it is a reality which has been suddenly enforced on us, and so it's not easy to deal with it psychologically, not for everyone. And my final question would be about you. So Helen, as the individual, as the mother, your daily routine during this lockdown period, what does your day look like, and how are you handling it from your psychological perspective?
Well, I think it goes up and down for everybody. I mean, I would love to say that, I'm getting up at 5 and making a green juice and doing some yoga and, all these things, but the reality is not quite that way. And I think for most of us, we're still figuring out what kind of a normal routine or a new normal routine looks like. But I'm finding that my concentration span is a little bit more challenged, because I think I'm thinking about so many different things, and information is constantly being recalibrated about what's happening in the outside world. So I'm trying to get up and do my thinking work, if you like, any writing or sort of more sort of intellectual projects first thing in the morning, because I find that my brain is fresher at that time, and also my kids are still asleep, so I can do my work well at that time of day. And then I'm trying to get my children up and keep them in some kind of a routine. It's not the same routine as they had before, but get them up and dressed, get them doing some kind of schoolwork activities or creative tasks in the mornings. We tend to have a family walk in the afternoon to get our fresh air together as a group. So that's a nice chance for us to chat. I have 2 children, so a teenager and an 8-year-old daughter. So we go out and try and get a bit of fresh air. And we're lucky at the moment because we're in the countryside, so we can walk without seeing too many people. And that's a big booster for us as well. To be in nature is very good for our psyches. And then, a lot of the time it is just trying to think of positive things that we can do. So work routines are quite disrupted. So what else can we do? How can we turn our skills into something positive? So I'm developing a project at the moment, actually developing the conversation we've just had into a bigger idea of telling tech for good stories in different aspects, where people in my world are providing solutions to deal with the current crisis and also to deal with the future impact of the crisis. So I'm working with Dr. Jane Thomason, who's a colleague of mine, to create some online webinars and pre-recorded speeches and so on, where we look at kind of positive stories that not only cheer us up, but also genuinely will have a positive impact on the world and try and get us out of the current fix that we're in.
And bring new solutions, which we're going to need. Helen Disney, founder of Unblocked, thank you indeed for this insightful conversation.
Thanks so much for having me. It's always great talking to you.
Thank you for listening to the Athena 40 podcast, Bouncing Back. Stay tuned. More episodes coming up. Please feel free to subscribe. Athena 40 is hosting conversations with thought leaders, entrepreneurs, influencers, and decision makers from all over the world in this effort to find our new normal. You can find more information on us on athena40forum.com. Have a great and inspiring one, whatever you do.